marginal ridge, what do you think is going to happen when you apply force on these teeth? Occlusal force on these teeth. So in such a case where you have a huge cavity with nothing keeping the cusps in place, the cusps will be prone to flexion. So do you see this? You see this? The cusps are prone to flexion when there is nothing holding the cusps together, which means the marginal ridges are now lost and they no longer hold the cusps together, and eventually at some point of time when this force is continuous and intermittent, you're going to see a fracture in the tooth. So basically, what are we trying to do when we're trying to place a crown on the top of a root canal treated tooth? What are we trying to really protect? We're trying to protect the cuspal anatomy. We're trying to protect the cuspal function. And because we didn't have any other option, that's the reason why we were going in for full coverage crowns. But if our aim today is preservation of tooth structure, so all of us agree to that? All of us agree that our aim today or our end goal today is to preserve tooth structure at any cost, right? Because the longer or the more the tooth structure you're going to have, the longer the tooth is going to last in the patient's mouth. So today if I have an option of doing a crown versus an onlay or a partial restoration, I will choose the partial restoration because in my mind I know once I've done a root canal and a crown, I have limited the life of the tooth. Eventually there will come a day when the tooth is going to have secondary caries, it's going to fracture and the crown is just going to break off or the crown will have nothing to support it. But today if I treat these teeth with a partial restoration, I still have the option to convert it into a full coverage restoration a few years down the line. So I have kind of elongated the life of the tooth. And that is the reason why partial bonded restorations are becoming very, very popular today. People are attending courses to learn this because we never learned it in our college days. So today people are going out and learning how to do these kind of restorations because this is going to be the future in dentistry. So, why is cuspal coverage required after root canal treated tooth? So there is convincing evidence that cuspal coverage after root canal treatment should be provided for posterior teeth because access preparations result in greater cuspal flexure. So if your cusp starts flexing, eventually they're going to fracture. So basically, the job of the marginal ridge is to keep the cusps splintered together. And that is exactly what you're trying to do with a partial bonded restoration as well. Now if you look at this picture here, now do you know the reason why this tooth is fractured? Can you now understand why this tooth is fractured? Can anybody tell me why this tooth is fractured? Why is this tooth fractured? Loss of? Absolutely. So passive filling in the center of the tooth, not allowing the cusp to stay in one place, cuspal fracture, eventually the cusps are going to fracture. What about this kind of a situation? A class 1, right? A class 1 situation where both the marginal ridges are intact. How would you treat this kind of a patient? Say you've gone in for a root canal, you've done a root canal, would you want to crown this tooth? Or would you want to give a cuspal coverage for this tooth? Do you think we would require a cuspal coverage where marginal ridges are intact? Not required, absolutely. So today, if you have a class 1 root canal treated tooth, we do not crown it. We do not cap it, we don't need to place an onlay on it. Why? Because the marginal ridges are there, they're doing the job of keeping the cusp in place. It's only when these marginal ridges are lost, like in the case here, or in the case here, that we need to think of capping the cusps or providing additional support to the cusps. So that is why we can play in between giving the patient an option of an onlay or an overlay or a tabletop restoration versus a crown. How do you make that decision? How do you come to that decision? You decide that by the amount of tooth structure left. So if you have the entire tooth structure left with only a loss of the marginal ridges,